Chris Motz, welcome to the Tokyo Living Podcast.
Thanks for having me, Sam.
And thank you for joining us from over the other side of the world. You can maybe
Yes.
tell the listeners where you're calling in from and what time it is over there.
Yes. So I assume, unlike a lot of other guests, I'm actually not in Tokyo right now, but I am in Toronto, and it is 7 p.m. I just finished dinner.
Okay, all right. So it's still
Yeah.
a fairly reasonable time. We haven't got you up in the middle of the night or anything like that.
No, no.
Perhaps if you can start by giving the listeners and viewers a bit of background on yourself.
Yeah. So as many of you assume, I'm from Toronto, Ontario, but I actually haven't lived here for a lot of my life. I've went to university in the United States and studied business in Philadelphia. Afterwards, continued schooling uh, in London and at the Imperial College London. And when I was there, I was fortunate enough to spend time abroad and on exchanges in Tokyo and Singapore. And it was when I was in Tokyo that I came across, how difficult it can be to find healthcare services as a foreigner or just anyone unfamiliar with that environment. I loved living in Tokyo, by the way, but it was just quite, it was quite a shock getting used to all the systematic changes
Yeah.
being there, especially for only about 6 months. So after that, after graduating, I've worked at a number of marketplace startups, very generally in marketing roles. But I couldn't kind of shake my experience having lived in Tokyo and having struggled finding healthcare services as an expat, which is what inspired me to start working on Rome, began, which is a service to connect foreigners, to connect expats, travelers to healthcare services abroad.
Yeah, great. And so, just for a bit of reference, when were you actually out in Tokyo, and that was part of your studies, or were you working out here?
Yeah, no. So as part of my studies for when I was in London, my
Mm.
program was a master's of design program, and as part of that program, we did exchanges at KO University.
Okay.
So I was studying at KO University for 6 months, at the first half of 2019. So
Okay.
right before the pandemic hit.
Right, right. And I guess, do you have a particular experience or even first experience with the Japanese medical system where
I
you started to think, this is a bit different and this is a bit difficult?
Yeah, so I do have a light bulb moment. So it was I was when I was a couple months into living here. I had my permanent retainer on my bottom teeth broke, and it was sticking up, jabbing my tongue, and it's a rather strange thing to happen because it's I'll call it like a non-emergency where
Mm,
it's urgent in that you have to get it treated immediately because you're actually in a fair amount of pain. You can't really
yeah.
eat, but it's certainly not life threatening or anything like that. And so my initial reaction was to go to the school and have them find the closest dentist for me. And they did refer me to a dentist across the street. I went there. Unfortunately, he couldn't really speak English. Like he could see what was wrong with me, but he couldn't quite articulate what was the appropriate thing to do, what the treatment was, and he ended up just gluing it back down, which didn't really work, and they kept breaking over and over and over again,
Mm,
and it just didn't really fix the issue. And at the same time, I my parents were visiting, and I been complaining about my retainer to them, and they had this asked the concierge at the hotel to find a dentist, and they did that, and the concierge phoned up a good English speaking dentist in Nakasaka, and it was great. Went to him, he ripped it out. So I fixed the problem. He just took it right out. But it ended up being like $200, I think, to go to this dentist. And not everyone has the luxury of being able to ask a concierge or even a friend or even just someone within a local within Tokyo of what to do
mm.
when you need to go to the healthcare services. And that kind of like, okay, this is clearly an issue. And then I spoke to a lot of my fellow students and other friends and other foreign friends in Japan, and I was like, yeah, this is like a thing that happened. This is definitely an issue that happens of not really knowing what to do when it comes to finding a doctor in in Tokyo. And then, you even get these extreme circumstances. So people just keep putting it off until they fly home for the holidays or
Mm.
something to get it treated. So, it made me realize that there's a huge opportunity here, and there's obviously a problem, and there must be a better way to find healthcare services, in the biggest city in the world.
And what, I mean, do you have an idea just from your, I guess, somewhat limited experience, why it is so difficult out here, and what some of the unique challenges are?
Yeah, so I think it's interesting. Like, uh, I think relatively speaking, Tokyo does have like a small expat population compared to a city like London or New York or
Mm.
Toronto with much with much larger foreign born populations.
Mm.
But the reality is that Tokyo is going to, because there isn't a there, because the vast majority of people living in Tokyo are Japanese, it means that there aren't naturally as many resources of how to use some of the basic services in Tokyo, such as healthcare, or even um, getting your registering to get your your resident card, or whatnot,
Yep.
going to your local ward office or something. That you
Yep.
kind of have to have someone guide you through it. So because because the expat population isn't as large, there just are not as many resources of like how to live your life, as a permanent resident in Tokyo. So there's that, and then there are all this the basic structural changes when it comes to healthcare. Say in Tokyo, at least coming from a North American or European perspective, where you're used to going to a GP or a family doctor for all your care. That's not
No.
It doesn't quite translate the same,
Mm.
the same way in Tokyo. Like, if you were to task a Canadian to find like an internal medicine doctor, like it doesn't really mean anything to them when it's, I guess, like the closest to a generalist
Yep.
within Tokyo. So that's another challenge, is just understanding like just the structural differences within the system,
Mm.
and knowing, okay, like given that I have, this wrong with me, like what's the most appropriate place for me to go.
Sure. Sure. And so I guess that sort of experience has been just sort of brewing in you since you left Tokyo. When did you sort of decide that this that you may be able to use your skills to help others by setting up, this sort of concierge service that you have?
Yeah, so it's sort of an idea that I'd been pursuing, like after living in Tokyo, pursuing maybe from like an academic perspective while I was still in my program, and just sort of as like a restanding of just a general research study on global health trends, and what's from researching it from an academic perspective. And that
Mm.
continued throughout 2020, and then I'd say sort of mid 2021 is when I switched from from contract work to like working on it full time, and to really pursuing it, uh, to its fullest. And it's just mainly just because there's an idea that I couldn't shake, and it just seemed, especially with COVID, like health is obviously the first thing, the first thing in a lot of people's minds. And I think coming out of the pandemic, I would naturally assume that people are going to be, one, this is going to, firstly, like a resurgence of travel, but at the same time, like people are going to do that, like being much more health conscious than they previously would.
Yeah, sure. And so how did you get started? How did you start accumulating that sort of database of local practices here?
Yeah, it's, to be honest, a fairly manual process. Like there's no, you got to do things that don't scale first.
Yeah.
So I think, like, obviously the first city that I chose to do it for was Tokyo, and that was based on my experience having lived there, and having a rough understanding of the specific challenges of living in Tokyo, as well as I think the unique features of it that I mentioned earlier. So I started by just sort of finding a way, by just thinking, okay, what are the basics of the system, like how can you articulate that in like a Google Doc, or like a simple format for someone to read and understand, and get get those questions. So compiling, doing my own research and compiling that on one or two web pages. And then the trickier part was, finding a good database of providers and clinics that, can verify, speak English, and can provide high quality care to foreigners. And unfortunately, there was not a great way of doing that. It's just not extremely manual. And a lot of that's just scouring the internet for like other blogs and resources and forums to see what people have said. Verifying that, if the website, and I'm sure there's not. I've been on a lot of Japanese clinic websites in the past year, and not all of them are very good, and not all of them have especially good information written in English. So going through them, looking at the information that they post about themselves, compiling that, and then finally calling a lot of these clinics to verify their information and to make sure that they actually do treat they actually can treat foreigners and provide care in English.
Sure. And you said that you sort of started that off in Tokyo. Have you got providers in other parts of Japan?
No, just Tokyo now. The next the next goal for the next the next step for me is to just perfect it, to just refine it within Tokyo, and whether that means whether that means moving to like Osaka or other major cities in Tokyo, or kind of doing it all again, starting in Seoul or Singapore or Hong Kong or something. I'm not sure. I'm not sure at the moment, but it's going to be one of those two.
Yeah, sure. And so how does it work for the users? Is it a paid site, and how do people actually gain access to the database that you've got?
Yeah. So at the moment, it's completely, it's completely free to use, and that's just, from the product that's offered right now is a guide of how to understand the Japanese healthcare system. So just, a written guide broken up into where to go. So the explanation of the services available, what to expect. So maybe some of the procedural and care differences that might be there. And lastly, cost of insurance. So understanding presenting cost estimates and price breakdowns. And insurance options that might be available depending on how long you're living in Japan. So that's the guide portion of it. And then the other portion of it is that directory of English speaker services, which is a list broken down by specialties, and then provider pages with more detailed information on individual provider page. And all that's free. All that is free to use at the moment. And then eventually we'd like to move, to be offering more hands-on services that we would charge for, such as providing more like a concierge service where we handle direct bookings or even insurance reimbursements and monetize, starting to charge for that. But at the point where it's just the database and just the aggregated information, that at the moment's just free to use at tokyo.romemedical.com.
Okay, perfect. So I was going to make sure that you get the website out there, and we'll put that in the show notes. Do you have any sort of presence on social media, in terms of the site, on Instagram or Facebook or LinkedIn or anything like that?
I've made the accounts. I actually forgot the handles. But yes, I'm on Instagram and Facebook. I think it's just for both. I'm pretty sure it's just Agro Medical.
Okay, perfect.
Yeah.
And you talked about maybe sort of expanding this to other countries as well, and providing more of maybe in the future that sort of niche concierge service. Any other sort of bigger goals for the future of the business?
Yeah, definitely. So I think there's so many aspects when it just comes to global health. So if I wanted to say what's the goal of Rome, it's just like to make improve greater access to healthcare services all around the world, or just simple terms like make people less sick abroad. So and I think there's just the whole process is just like so opaque, and it just improving the general, people's not even just like the access is one part, but also just changing people's mentality and how they think of healthcare services abroad, and demystifying that experience for a lot of people. I think another issue that I think is really interesting and that I do want to tackle further down the line is the issue of interoperability. So especially, for those digital nomad types or even long-term casual travelers, that's a huge problem. Or even people just when they first move to a country, it's very, very difficult to travel and to produce any sort of history of care or any
Mm,
sort of record of treatment
mm,
from a different country. Even within countries, it's extremely difficult.
yeah.
And that's that's really important when you have people who are managing chronic conditions that they have to
Mm,
get treated just imagine someone with diabetes having to get that treated and it's treated in multiple countries across several months like that. It can be a pain. It can be a pain having to go to a new country and in a lot of cases going through the same diagnostic procedures
mm.
in every new country. So that's the next, after as once Rome's able to provide greater access to healthcare service, the next big challenge is improving interoperability, because ideally this is something you could use anywhere. You could use anywhere.
Yeah, yeah. Excellent. Well, I think it's an amazing thing that you're doing to, I've been out here for almost 18 years, and yeah, I'm lucky to work in the medical sector, so I do have access and connections there, but it's still a difficult thing to navigate, and I know a lot of people struggle with it. And so, yeah, we really appreciate the work that you're doing to try and help people out here. And I think as you progress the business forward and expand on this, it'd be great to have you back on the show and maybe talk about some of the other projects that you're working on.
Definitely, yeah, I love that.
All right. Well, thank you very much for your time today, Chris, and looking forward to speaking to you again soon.
All right, thanks for having me, Sam.
All right. Cheers. Bye.